Call Dan Carden to move.
Thank you, Mr. Deputy Speaker. I beg to move that this House has considered the matter of guaranteeing the right to contact in care settings. After much delay due to circumstances outside of our hands, I'm grateful that we now have the opportunity in this chamber to debate this incredibly important issue. Can I start by thanking the Backbench Business Committee for its efforts in finding us time to speak in the chamber about this today. And I also want to extend my gratitude to the Honourable Member for Chatham and Aylesford and the Honourable Member for St Albans and the Honourable Member for Dyford Merredon for their steadfast and resolute support and advocacy on this matter throughout. People across the United Kingdom are still having to face their time in hospitals, in care homes and other care settings completely alone and detached from the people that they hold dearest. They are some of the most vulnerable and frail people in our society. Some of them will be nearing the end of their lives. The devastating impact of this isolation and of denying contact with loved ones affects those in receipt of care and also their loved ones. It is difficult to imagine, unless you have personal experience, the anguish, the pain and distress of not knowing when you will next see your loved one, your husband or your wife, your mother or your father, and repeatedly asking yourself, are they okay? Are they comfortable? Do they even know that I care? That same anguish and pain is experienced by the individual receiving care, not understanding why family or loved ones are not able to visit. Shirley from my constituency said, "My father forgot I was his daughter during the period I was unable to visit. When I was finally able to visit, my dad was unrecognisable. It broke my heart. He has never recovered." The support of partners, the care that they give, the care given by parents, by children, this isn't an optional extra. Contact with loved ones is absolutely vital to dignified care. This point was also made by the 363 members of the public who in the last few days alone provided written evidence for this debate, and I want to thank them for their brave contributions and the Chamber engagement team for collecting them. I know that throughout today's debate we'll hear further personal experiences from across the chamber. But I hope the House won't mind if I take a moment to talk about my own family's experience last year. My mother and brother have contributed a few words to this, and I'm grateful to have the opportunity in the chamber to express them. Because my father, Mike, died last year. He was diagnosed with lung cancer in February and died in December. Like many people undergoing cancer treatment, one evening he suddenly became unresponsive and we had to rush him to A&E. At the hospital, it was confirmed that he had sepsis and he was therefore isolated in a side room on the A&E ward, which was overrun with patients on beds and trolleys in the corridor. My dad was in an A&E side room for 3 days, during which time he didn't receive any hot food, he wasn't showered or washed, nor assisted in changing his clothes, and he was unable to get help to go to the toilet. Instead, he was given cardboard containers which were often left full on his bed table for days, despite regular requests for them to be taken away and replaced. And throughout this time, he had no means of contacting us because there was no phone signal where he was and he couldn't access the Wi-Fi despite repeated attempts. There were other occasions Once he had to be moved to a ward when he was left with his emergency buzzer out of his reach. And one time when he couldn't breathe and began to panic, he phoned my mum, who was unable to get through to the ward by phone and therefore rushed to the hospital. He told us after these experiences that he had felt so lonely and neglected and unable to alert anyone to his basic needs. And my dad was a man who never liked to make a fuss. The hospital policy at the time was that visitors were only allowed for patients who were in end-of-life care. The NHS website defines this as follows. End-of-life care is support for people who are in the last months or years of their life. End-of-life care should help you to live as well as possible until you die and to die with dignity. The people providing your care should ask you about your wishes and preferences and take these into account as they work with you to plan your care. They should also support your family, carers and other people who are important to you. However, at the time, the hospital defined end-of-life care differently and restricted visiting rights to those patients who were actively dying. In other words, that they were displaying the physical symptoms of dying. My mum said, this meant that instead of being able to focus on caring and supporting my husband through his final weeks, we had to battle with the hospital to see him. The trauma of my husband's death, and in particular the neglect he experienced in his final weeks of life, remain with me. It is almost exactly 1 year since Mike was admitted to hospital, where he spent the last month of his life, and I am still overwhelmed each time I attempt to talk about what he went through. I want to also turn to the words of one dementia sufferer, who said, I'd forget that I had an allergy, but my daughter was there to correct me. If alone, I would simply have said I didn't have an allergy, and that could be so dangerous. The lack of input from family and friends, the people who know people best, leads to much worse outcomes for those receiving care. In March of this year, we invited affected constituents to an event where they could share their experiences with parliamentarians on the estate. The testimonies we heard were harrowing, and the collective trauma was palpable. To give just one of the contributions from that day, sitting with my mother's body was the longest time I had been allowed to spend with her since she had entered the care home 16 months before. The powerful event that day left members of this place that were there united in the view that a legal right was needed to secure the right of care users to nominate an individual to provide support or care in all circumstances. Many of us at the event were disappointed by the response of the government and the Minister for Care. Since then, 60 members sent a letter to the Secretary of State for Health and Social Care, at that point the member for Bromsgrove, pushing for codification, a legal right to be put in law. We were again left disheartened by the response from the Minister. While we were told that the government was committed to ensuring care home residents have access to the support and companionship that loved ones bring, there was no answer to our request for a meeting or consideration of our proposals. Understandably, campaign groups felt ignored once more, and I hope the Minister today will not leave those affected feeling the same way. This problem is not exclusive to the coronavirus pandemic. There are still rigid restrictions on visiting as well as shocking instances of denying contact. Another of my constituents reported, my family and I have never been allowed into the care home that he now resides in. Restrictions have caused unnecessary stress and anxiety to my family and I. I will be brief.
I wonder would you agree with me that now is exactly the time that we should be considering this, because as we go into the winter, the option of imposing restrictions is going to become an option that many care settings are considering. And I think that guidance alone has proven insufficient. And this is amongst the lessons that we should have learnt over the last 2 years. And now the government should be acting.
Yeah.
I'm grateful to my honourable friend for that intervention. The government has previously pointed to guidance as being the defence against bad practice, and I think we have enough evidence to see that that simply isn't good enough. Indeed, while there are some excellent examples of good practice across the sector, there exists significant levels of uncertainty and variability throughout the system that seriously undermine the rights of individuals. The guidance leads to a postcode lottery as separate settings interpret guidance differently. This difference of response is compounded by the response of the CQC, an organisation that I know many have had difficult and negative interactions with. The government encourages those affected to report care providers who do not meet this guidance to the CQC. But by then, it may be too late. This poor response is not because the CQC ignores complainants, although there was evidence of this as well, but they simply do not have the proper powers or data to support people to have visitors who have their access rights compromised. In the CQC's own words, we do not have the power to require care homes to report live data on levels of visiting. Neither do we have the power to take action against those care homes that are not reporting changes to their visiting status to us. The CQC, which regulates all health and care services in England, bases its enforcement action on the capacity tracker. However, providers are not obligated to use this tool. They're merely encouraged. And this has led to very little, if any, clarity on the true extent of the problem. By comparison, in Scotland, the National Care Service Bill places a duty on ministers to require providers to comply with any direction made regarding visiting. So can I ask the Minister, what assessment has the Department made of this legislation, and would they be minded to introduce similar provision in England? The evidence suggests that the only way to guarantee contact in care settings is a legal right to an essential care supporter. An essential care supporter would be able to visit or accompany a person in any health and care setting to help communicate their wishes and needs and to ensure they receive the correct care. If the government is serious about their support for these calls, if they're serious about acting in the interests of families and loved ones, if they're serious about balancing clinical restrictions with the impact of those restrictions on residents' health and human rights, then I would ask the Minister to immediately consider how to put this into law. I can't think of any other issue that commands such unanimous cross-party support. Indeed, as the Right Honourable Member for Leeds Central, who I know supports these calls wholeheartedly, said at our meeting in Parliament, how can anyone be opposed to this? There are also 35 organisations in the area, in this area, who support these calls, including Mind, MenCap, Disability Rights UK and Dementia UK. The new Secretary of State for Health has previously signalled his support for this right. We are ready and willing to work with the government to make this legal right a reality as swiftly as possible. The Joint Committee for Human Rights has also been unequivocal in their call for legislation in this area. In their report from July of this year, Protecting Human Rights in Care Settings, they stated that the government must introduce legislation to secure to care users the right of one or more individuals to visit and provide support or care in all circumstances, subject to the same infection prevention and control rules of other staff. We have not yet had a response from the government to this report, so may I ask the government minister to take this up. We have opportunities in the draft Mental Health Reform Bill and the Bill of Rights to codify this right. The government could also introduce secondary legislation, which I know campaigners are in favour of. So will the Minister meet with me and others and the affected families as soon as possible to discuss making this right as strong and effective as possible? The government has previously said that legislative options are under active consideration. So please can the government give much more specific detail of what this actually means? And I want to finish by paying tribute to the tireless campaigning of organisations in this area, particularly the Rights for Residents Campaign Group, the Relatives and Residents Association and John's campaign. The work of Jenny Morrison, Diane Mayhew, Helen Wildbohr, Julia Jones, Nikki Gerard and Kate Meacock has been absolutely inspirational. They are all in the public gallery today watching this debate, and their dedication to this campaign has been phenomenal, and I pay tribute to them. In the face of immense loss and personal grief, they have shown incredible selflessness and service to guarantee that no other family member will have to endure the pain of being denied contact again. Families do not deserve any further delay. They have suffered enough. We must learn from this trauma and bring in legislation. I hope that when the Minister rises to give the government's response, she will agree and set out the steps that we can now take to get this right. Thank you, Mr. Deputy Speaker.
Thank you, and deepest condolences on your loss as well, Dan. The question is on the order paper, co-sponsor.